Everyone's asking me right now what Donatella Versace has done to her face over the years. She's had an incredible transformation, and we're going to pick the bones behind it to see what exactly she may have had done and how she's achieved this result over the years. My name's Dr. Somji. I'm a cosmetic surgeon. Let's get into it. Here we can see a picture of Donatella Versace looking amazing at the opening night of the Devil Wears Prada musical. Everyone was kind of stunned because even myself, many years ago on Instagram, I did a post looking at Donatella Versace's work. And let's face it, it maybe was not the most natural. Everyone's entitled to have treatments. And you know what, whatever makes you feel good is great. But she got a lot of criticism beforehand because of maybe their work looked a little bit unnatural. But we're gonna take it back to even when she was younger and see what's happened in her face over time. And perhaps we can learn from some of the mistakes and even some of the good things that she's done over time to prevent things looking a little bit unnatural. So here we go. So this is the first picture that we can find of her in 1993. She's 38 years old, so still very young. It's very unlikely that she's had any work done at this point in time. She's got a naturally contoured face, so she's got beautiful cheekbones. She's also got that stronger jawline, which is fantastic. What you can see is that she's already got a heavy brow. So some people are born with just a heavier brow bone in this area, and it means that you're gonna have excess lids and your brows are not, let's say, raised, they're a little bit more horizontal. And that's natural to embrace that. It's quite common for people to complain of heavy brows even as early as like in the mid-20s, especially if you've got that bone structure. But you can see that she's got a few fine lines around the nasolabial folds. Nothing much to shout home about. She's always had a low body fat percentage, and you can see that she's got that hollowing, which is a natural hollowing in this case, in what we call the submalar area. So you can see at this point in time, if you're going to be treating this patient, you'd be saying do stuff that's preventative, use good skincare, protect from the sun, maybe do some collagen inducers, nothing too major. You can also see that her nose is a lot more refined than what we'll see in later years. So she really hasn't done much at this point in time. And you know what, in these early 30s and mid 30s, it's important not to do too much really, not to make any wholesale changes and just embrace your natural beauty. In 1997, it's 6 years on, she really hasn't aged too much. We can see some more hollowing in the face as well as more fine lines and wrinkles in the lower part of the face, but it's entirely appropriate for her age. But we can see a change around her eyes, and it's an improvement. She's definitely had something to help open out the eyes. That could be a blepharoplasty in that area, just to remove some of the excess skin, or even one of the first brow lifts as well. So this is something that she's quite conscious about, because if you've got a heavy brow, sometimes it makes you look a little bit more masculine, particularly if you've got a naturally square jaw like she has. So she's definitely had a raise in that area, an eye opening, and in fact it looks pretty natural. You can also achieve this with botulinum toxin injections to inject in the muscles that depress the brows to open it up to give you that fresher look. So she may have well done that at this point in time. What we can also see in this picture that's a change from 1993 is a slight fullness within the nose. That bridge is becoming a little bit wider. Normally, yes, the nose becomes a little bit wider with age because we lose bone in this area just underneath the nose, and it spreads ever so slightly. But it's normally a change that happens a lot later in the aging process, not as early as this. So this is probably the first sign that she's having some sort of volume to contour the nose injected in the nose. So it's very likely that she's had some dermal fill in that area that's given her this wider look in the nasal region. So here we have it. In 2002, there's a big change. She's nearly 50, she's 47, but we can see that there's way more volume in the face. This could just be weight gain, but it's unlikely because you can see that it was pretty much a trend in those time periods to inject a lot of filler in the cheek area. We don't do this anymore because it can make you look a little bit, let's say, edematous, which is gaining weight in that area, and a bit too, let's say, cheeky. And it means that when he smiles, you can see over here, her eyes look a lot smaller. The other thing that we can see is that there's very few fine lines and wrinkles in the forehead. It's actually super smooth. This is definitely because of Botox. Botox does give you that look. The other reason why we know that this is Botox is that if you compare it to the image before, her eyes were a lot more awake and open. But when you put a lot of Botox in this frontalis muscle, the muscle that helps us raise the brow, it drops it down. So you've got whatever lift that she had with her blepharoplasty or surgery that she had previously, it's gone because she's now got that little bit more of a heavy appearance back. And she's also got that little bit more of a pillow face going on because she's got that filler in her face. So she looks a lot more, let's say, overweight than she actually is. She's a very slim individual. She's never been overweight, possibly even a very low body fat percentage. But because of the fillers, it makes her look like she's got more weight than she's got. The other thing that we can see, which is a big change in this time period, is the size of her lips. Up until this point, she didn't touch her lips, but you can see that she started to have lip filler to increase the volume of her lips. In fact, if you ask my opinion, her lips were always absolutely fine, but because she's gone for more volume in the cheek, probably in her mind and in her surgeon who's ever treating her, hey, because the cheeks are bigger and the features are a little bit more bigger, the lip may have looked a little bit smaller. So the decision was made to add volume to the lips at this point in time. So let's say she's got a little bit more volume all around in this picture, as well as Botox that's giving her a lot more heaviness. What we can see is that the nose is changing. This could be an implant in that area, could be dermal filler to add more volume. We can see that the bridge of the nose is much wider, more defined. And this is more that there's more volume in there as opposed to a rhinoplasty making it slimmer. In fact, the tip is probably a little bit over injected. As you can see, it's projecting downward, especially when she's smiling as well. So this was the time of where people used to do a lot more fillers, and Donatella Versace was probably one of the early adopters of that. Now, let's move to 2005. We can see that there's more changes going on. We can see that the mid-face is still retained that volume. Maybe more volume has not been added to that area. Definitely still Botox in that area, but you can see that the brows have come up again. So this could be another surgery, possibly a temporal brow lift to give what we call more lateral suspension of the eyebrow to give that a little bit more opening. This is definitely something that's surgical that's taken place again within this area. Could also be a little bit more of a blepharoplasty to remove a little bit more excess skin in this area, but definitely she's trying to get that more raised look in this picture. We can see now that the lip fillers have continued. Before there was that subtle, little bit more natural increase in volume. Now it's gone a little bit too far because the lip is protruding. There's also a little bit of migration of lip filler above the border as well. And when she's smiling, it's looking a little bit puffy and unnatural. Also making her chin appear smaller because the lip is bigger in that area as well. So it's really important when you're having dermal filler to look at your whole face as a harmony and say, well, when I'm treating one area, does it mean I have to treat other areas to balance it? And if you don't want to do that, then hey, that's probably not a good road to go down because you end up starting filling everything within the face. The key is to have facial harmony, looking at, yes, each of your features in isolation, but seeing how they fit together. And that is where we talk about like the rule of the fifths as well as the thirds. So each fifth of the face should be correct and all your facial thirds should be correct as well for your own natural proportions. We can see in 2005 that she's got the emergence of what we call platysmal bands. If you're quite slim, the platysma muscle gets a little banding where it almost gets stuck to the surface of the skin. And that is probably one of the first signs of aging that you can see within the neck area. It's not a bad thing at all, but it's normally seen in people that are a little bit slimmer in the neck. She's not addressing that at the present moment in time, and I always think it's quite natural as long as there's no sagging in the low part of the face. But this is one of the changes that happens over the years, and you'll see in her picture in 2011, there's a dramatic change in the neck area. We can see that the neck area is looking a lot more lax, a little bit more loose, and this is something that happens naturally over time. Now, there are differences in her facial features over time. She's had that volume in her cheeks for a very long time. We can start to see emergence of something called festoons, which is a little bit more of a prominence, a swelling around the side of the cheek. This can happen naturally over time as malar edema, where there's impaired lymphatic flow underneath the eyes, but it also can happen as a result of too much filler, not only in the cheek area, but also in the tear trough, because filler is made of hyaluronic acid that attracts water. And you can see, even though she's got makeup on, that little bit of swelling on the side of her cheeks, both sides. We also see that as we age, we lose volume. So we know from anti-aging studies that as you lose bone, particularly within the temple area, angle of the mandible, as well as the chin, the soft tissue starts sagging. if you haven't addressed these things over time and you've just used things like filler without maintaining the collagen density as well as your bone density, then the soft tissue is going to sag. And if you've put more volume in there in your soft tissue, it's going to sag further. We can see that the face is starting to come down. And what you're seeing is a natural aging process accompanied by doing certain procedures such as the lip filler, as well as adding more volume to the nose. Because of the volume loss in the temple, the mid face is sagging at this point in time. The nose is slowly widening and getting a little bit bigger over time as well. This can happen in the aging process, but hey, I think this is a really important point that I always talk about with filler. If you're gonna go to your doctor and have dermal fillers injections only, I would say don't do it, because you need to be doing all of the things of aging, i.e. the 3Ds that I talk about. Deflation, so yes, replacing lost volume, maintaining your bone loss with supplements, vitamin D supplements, and having a healthy lifestyle and a balanced diet. Also, lift. Also, number 2 of that point is descent, making sure that you're lifting certain things. Donatella Versace is focused a lot on the suspension of her brows. The problem with temporal brow lifts is that they do recur in a lot of instances, and you need to get it done probably every 3 or 4 years, in this case with her bone structure, to maintain that lid position and that brow position. She hasn't done anything to lift the mid and the lower face yet, and this is where the problem is. Also, she's getting increased hollowing in this area, and that volume hasn't been replaced with things like collagen stimulators such as Sculptra. So what she's got in this period of time is that she's treated the mid face and neglected other areas, just over-treated the lips and the nose, and that's all we see as she's starting to lose volume over that time period. Then in 2014, things have changed over time. She hasn't really done much more, but she's added more volume, and this has given her more fullness in the cheek, perhaps what we call a little bit of lift, because you can't lift with filler, but she's just continued increasing the volume within the nose, increasing the volume in the lips, and increasing the volume in the cheek. That is never going to give you lift. That's just going to give you a rounder face. So she then made steps a few years later to say, hey, let's just forget about all this volume and let's try and lift as much as possible. We can see in this picture that she's had a deep plane facelift, including a temporal lift at the same time, because you can see the incision all the way from here, from her upper hairline all the way lower down. We can also see that the ear lobe, as it always happens after a facelift, is attached a lot lower on the face. It actually reveals that possibly this might not have even been her first facelift to counteract some of these concerns. But you can see that there's true examples of facelifts. Yeah, she looks a little bit slimmer, but a lot of that filler is still in. Even in her lip area, some of the filler has been removed, but it's still there. With the nose, we can see that the over-injection of filler or any other substance like silicone or even fat has slowly spread and widened in between her brows. So that still hasn't been sorted. And the reason why she looks so different in the pictures recently is that that nose area has finally been addressed. So let's go back to the latest pictures. Finally, in these pictures, we can see that the nose is looking a lot more refined. She's possibly had a rhinoplasty as well as removed any of those substances within her nose, likely to be silicone fillers, given how long that it's lasted as well as the weight. Her nose looks a lot more refined, the tip looks a lot more upturned as well. What we can see is that her eyes look fantastic, so she's definitely had another surgery around the eye area, possibly to remove the skin, some skin tightening treatments, as well as another temporal brow lift to really suspend that area. She had thinning hair at that point in time, so her hair, possibly the scars have been covered with hair extensions, maybe even a hair transplant to cover those incision marks as well. Because with the temporal brow lift, you could see her previous incision marks. Possibly the incision's been a little bit further back as well to mask it, but the hair is covering a lot of things and it's framing the face within this picture. So a little bit of trickery with hair and makeup always goes a long way. A lot of people have been accusing her of editing these pictures, but there is a limit that you can edit these kind of basal features. As you're coming down, she's got a nice, beautiful prominence to the cheek, great beautification point. all of those fat pads that had dropped down previously have now been suspended, and you can get this from a deep plane facelift. So it's very likely that she's had a true deep plane facelift to lift all of those layers back, put the fat pads in the right place, as well as remove the filler that was causing more weight and sagging. As we come down to the lower face, we can see that a lot of the over-injected lip filler has been removed. She's still got quite a bit of distance between her upper lip and her nose. And if there's one thing that could probably improve her further, is actually having a small lip lift, because as we get older, the upper lip lengthens over time. And this could just make the area a little bit smaller, the surface area, the height of that area of filtral columns smaller, so it can actually give her more of a natural appearance. So that's one way that you can actually have surgery, in this case, to look a lot more natural. She's got no jowls because it's all been lifted back, and her jawline, her natural jawline that we saw back in the day, has now been uncovered, and she looks fantastic. So I think that this is a great lesson of how somebody took non-surgical treatments a lot further than what it could do. There's always a point where non-surgical treatments may even cause more detriment, especially with injectable fillers, and you actually are better off having surgery to lift those fat pads back, to restore your volume and give that natural lift. Also, it's also a lesson to say, well, if you're going to do non-surgical treatments, you should always be tightening the skin, looking at your proportions. You can tighten your skin with collagen inducers such as Sculptra, as well as things like lasers, which are designed to add more natural collagen, as well as restore the elasticity back to the skin. So those are the lessons that have been learned from Donatella Versace. We put a lot of information in there. If you want any clarification, just let us know in the comments below. What do you think about her transformation? Do you think she looks more natural now than she did in the beginning? Let me know in the comments below and we can discuss.